In today's video, we're going to talk about diabetes in cats. With pet obesity on the rise, it may come as no surprise that cases of diabetes in pets are also on the rise. According to the annual State of Pet Health report released by Banfield Pet Hospital, the prevalence of cat diabetes has risen over 18% between 2006 and 2015. Although obesity is the biggest risk factor for developing feline diabetes, it's not the only one. Even if your cat isn't obese, it's important to be able to recognize the clinical signs of diabetes so that treatment can begin as soon as possible. Like humans, cats can develop diabetes mellitus, also known as sugar diabetes, a disease that occurs when the body can no longer produce or use insulin properly, says Cornell University College of Veterinary Medicine. Insulin, a hormone produced by the pancreas, controls the flow of blood sugar, called glucose, to the body cells to provide energy. Without sufficient levels of insulin, glucose doesn't reach the cells as it should, so instead the body starts breaking down fat and protein cells to use for energy, while unused glucose builds up to excessive amounts in the bloodstream. As with humans, there are two types of feline diabetes, insulin-dependent or type I, in which the body is no longer capable of producing any insulin, and non-insulin dependent, or type 2, in which either the body can't produce sufficient amounts of insulin, or the organs and tissues have become insulin resistant, meaning that they need higher than normal amounts of insulin in order to properly process glucose. Occurrences of type I diabetes in cats are rare, says VCA Hospitals. While the exact cause of cat diabetes is unknown, obese cats are the most predisposed to developing this disease. Other risk factors include chronic pancreatitis and hormonal disorders such as hyperthyroidism and Cushing's disease. Certain medications, including corticosteroids, such as prednisolone, have also been linked to diabetes. Male cats also tend to be more prone to this condition than females. Health implications of feline diabetes. Because diabetes causes the body cells to process energy from fat and protein instead of glucose, cats with diabetes will typically lose weight in spite of displaying a healthy appetite. If left untreated, diabetes can lead to a number of health complications, the most dangerous of which is a condition known as ketoacidosis. This occurs when the breakdown of fat and protein cells becomes so great that your cat's body is effectively starving even though she's eating regularly. Signs of this condition include appetite loss, weakness or lethargy, abnormal breathing, dehydration, vomiting, and diarrhea, and without immediate intensive care to provide fluids and insulin, it could be fatal. Other diabetes-related health complications may include liver disease, bacterial infection, unhealthy skin and coat, and neuropathy, which can cause loss of strength and mobility in the hind legs. Another complication can arise from the treatment of diabetes. Hypoglycemia, or low blood sugar, can occur when too much insulin is given, resulting in weakness, listlessness, and lack of coordination, and in some cases, it can cause convulsions and even coma. If your diabetic kitty displays signs of low blood sugar, try to get her to eat something. If she won't or can't eat, it's recommended to rub syrup on her gums and call your veterinarian right away. Signs and symptoms. A diabetic cat will typically display a combination of these four classic signs: increased appetite, weight loss, excessive thirst, increased urination. Excessive thirst and frequent urination are the signs most likely to be noticed first by cat owners. Often, because they need to go so frequently, diabetic cats will start relieving themselves outside the litter box. For this reason, it's highly recommended to see your vet if your kitty seems to forget her litter box training. Hello. This video is sponsored by BMX Pets. Are you looking for high-quality cat collars at an affordable cost? Check out bmxpets.com. Use coupon code KittenLife to get 20% off. Different types of diabetes mellitus in cats. Diabetes mellitus is usually classified into three types of disease. Type I diabetes mellitus results from total or near complete destruction of the beta cells. This appears to be a rare type of diabetes in the cat. Type 2 diabetes mellitus is different because some insulin-producing cells remain, but the amount of insulin produced is insufficient. There is a delayed response in secreting it, or the tissues of the cat's body are relatively insulin resistant. Obesity is a predisposing factor in type 2 diabetes, which appears to be the most common type of diabetes in the cat. Type 3 diabetes results from insulin resistance caused by other hormones and can be due to pregnancy or hormone-secreting tumors. Diabetes mellitus is common in the cat. Diabetes mellitus is the second most common endocrine disease in cats. It is seen more frequently in middle-aged to senior cats and is more common in males than females. While the exact incidence is unknown, The number of diabetic cats is increasing at an alarming rate due to the tremendous increase in the number of overweight and obese cats. It is important to note that a cat 3 pounds over its ideal weight are considered obese, and that means the average domestic cat weighing 13 pounds or more is at high risk for developing type 2 diabetes mellitus. Treatment of cat diabetes. Diabetes mellitus is a treatable condition. Although long-term treatment requires commitment and dedication, it can be rewarding to manage this condition successfully in a beloved cat. Initial steps in treating a diabetic cat include removing potential predisposing causes for diabetes. For example, some medications such as corticosteroids predispose cats to develop diabetes, and withdrawal of these drugs may lead to the resolution of the condition. Obesity is a risk factor for diabetes in cats, so weight normalization may actually lead to the resolution of diabetes in some cats. All cats with diabetes mellitus benefit from being fed a well-balanced diet, and your veterinarian is the best source for guidance about which nutrient profile will best benefit your cat. Many cats with diabetes mellitus benefit from a diet that is high in protein and relatively low in carbohydrates because a relatively low carbohydrate diet decreases the amount of glucose absorbed from the intestinal tract and lowers the requirement for insulin. Unfortunately, while nutrition is a critical element of diabetes management success in cats, it is generally not as easy as making a simple nutritional choice. Most cats require regular insulin injections to control the diabetes mellitus, at least initially. Your cat may require several hospital visits until an appropriate insulin dosage is determined. New technology has allowed the adoption of home glucose monitoring with the use of a simple device. Additional home monitoring can involve the evaluation of urine for the presence of glucose, although this is not a very sensitive way to monitor glucose levels, and insulin changes should not be made based on urine glucose levels. Most cats will achieve initial stabilization within a few days to a few weeks and will require once or twice daily injection of a small dose of insulin. Very small needles are available which cause no pain to the cat, and within a short time, the procedure becomes routine. Insulin pens are now available, which makes it even easier to give your pet an insulin injection. Your veterinarian will determine the appropriate administration frequency, dosages, and type of insulin that your cat requires. Clinical signs displayed by a cat with a very low blood sugar level include weakness and lethargy, shaking, unsteadiness, and even convulsions. If a diabetic cat shows any of these signs, it is important to take a blood glucose reading if you have a home monitoring device and seek immediate veterinary attention. In mild cases of hypoglycemia, you may observe wobbling or a drunken walk, or the cat may seem sedated when you call or pet them. Low blood sugar is a medical emergency. Your veterinarian can advise you about the specific emergency treatment of low blood sugar in your cat that you can deliver at home until the cat can be seen by a veterinarian. If you enjoyed this video, kindly press the like button. Also, don't forget to subscribe with notifications on, so that you don't miss out on videos like this. Thank you for watching.